Hello, I am Dr. Najamus Saquib. I am consultant psychiatrist at Asha Hospital. I am currently associated with Asha Hospital for the last almost 5 years. My areas of interest are geriatric psychiatry. So, geriatrics means people with old age group, especially more than 55 years of age group. As we all know, with increasing age, a lot of physical and psychological problems start. Like people with age of more than 55 years, they have a lot of medical problems like diabetes, hypertension and thyroid and many more diseases. Along with that, we cannot ignore the mental health of the elderly. In elderly, there are a lot of significant mental health issues. The most common mental health issues are anxiety disorders and depressive disorders, and comorbid medical conditions can complicate the presentation of mental illness, or they can change the presentation of mental illnesses. So it is very important that we identify all these mental health issues for the well-being on and for improving the quality of life of our elderly, so that it can also reduce the burden on caregivers of the our elderly family members as well. So as we know that elderly have special needs, like with increasing age their body structure changes, metabolism changes, morphology changes, hence their needs for diagnosing the various illnesses is also different. So we need to see in a different from a different perspective for the mental illness of the elderly. So we have a special department for the mental health issues of elderly people. It's called Geriatric Psychiatry Unit, where there is a team of experienced psychiatrists. I am one of the consultants. We have a group of therapists. So elderly with common mental health illnesses like depression and anxiety, and one of the most common illness in elderly is dementia, that is memory loss, which can be of various causes, because of various causes. So it is important to identify them at a time, otherwise in the future it can increase, and it can increase the financial and psychological burden on the family members. So we have various services like outpatient department, where we do a thorough physical and psychological evaluation, followed by assessment in the form of detailed neuropsychological assessment, memory assessment, followed by counseling of the caregivers, and how the counseling includes how to manage them at home, which is followed by monthly caregiver meetings as well. Also we have special services for this geriatric age group, such as daycare centers for dementia patient and a long term facility care respite care home as Golden Oak Center. So if you have any of your family members or elderly, you find any they are in need of some help, you can approach our website or our clinic. You can find more approaching to the website and